Hello, you're about to see some exercises that I've put together for those people who can't visit a physiotherapist right now. I've used my experience to sequence the exercises in the most logical and effective way. Now do remember, when you're performing exercises for conditions that can give you pain, they may be uncomfortable, but the discomfort that you get must be entirely tolerable. Essentially, if you feel that your pain is getting worse or your condition is worsening, stop. If you're experiencing any pins and needles or numbness in the legs or arms, stop. If you have any concerns, contact your healthcare provider. For each exercise you will see a picture with some text that I will talk through, and then we'll watch a video where possible. I've also got the general worksheet to show you at the end. These exercises are recommended for back pain, commonly in the early stages. This is often described as non-specific low back pain or non-specific low back pain without sciatica. Whilst you might experience some discomfort when you begin to perform the exercises, you should stop the exercises if it causes pain or you experience dizziness, numbness or pins and needles. To begin with, we'll start with prone on elbows. For this, you'll need to lie on a firm surface. Lying face down, slowly press up and prop yourself up onto your elbows. And to begin with, you may wish to use a flat pillow underneath your hips to take some strain off your back. Then relax into the stretch position. Don't hold your breath. And hold for up to 20 seconds. Go back down again, let the dust settle, relax. And then repeat. Come back up onto the same position and hold again. Do 3 of these in 2 sets. The next exercise, for which we don't have a video, is the quadruped alternate arm. Whilst kneeling in a crawling position, slowly raise up one arm in front of you. Hold and then slowly lower, returning the hand back to the floor. Repeat with the other arm. This is very good for integrating an early tummy contraction, so to keep some signals going to your abdominal muscles. That can be helpful in supporting your back and helpful in reducing pain at the same time. Prone hamstring curls. Lying on your front, face down. Slowly bend your knee as you lift your foot towards your buttock. Lower the foot to the floor smoothly and repeat. So get into a rhythm when doing this exercise. It's very good for starting to take tension out of the front of the groin and pelvis and thigh. It can also reach into back tension, but what it does do is mobilize a tissue common to both the back and the leg. That's the femoral nerve, and that can help reduce back pain. So you're doing 10 of those without holding, completing 2 sets. Then we turn to single knee to chest. This induces controlled, steady back flexion. So whilst lying on your back, hold your knee and gently pull it up towards your chest. Lower and repeat. Continue to do this 10 times. When the set is complete, repeat with the other leg. And do this twice. So the whole sequence you're performing twice, 10 with each leg. It's a safe way of introducing back bending. This is the pelvic clock between 6 and 12. So you're lying on your back in a relaxed position with your knees bent and your feet flat on the ground. Next, imagine a clock resting on your tummy. Tilt your pelvis so the clock tips towards 12 o'clock, which is nearest your head. That's the posterior tilt. And then lower the back as it goes firmly into the floor in this position. Then reverse the direction, tilt your pelvis so the imaginary clock tilts towards number 6 or towards your feet, the anterior tilt. That takes pressure off your lower back and creates space between it and the floor. Repeat this with smooth, controlled motion, so you're inducing a gentle rocking, pelvic tilting between 12 o'clock and 6 o'clock. So imagine that clock and tilt between 12 o'clock towards your head and 6 o'clock towards your feet. And just repeat as in the motion on the video. Side-lying trunk rotation. So relaxed whilst lying on your side with your knees bent. Slowly twist your upper body to one side and rotate your spine by moving from your shoulders. Don't hold your breath and get into a gentle rhythm. Do 10 repetitions and complete 2 sets, and then turn over onto the opposite side and do the same. This is controlled lumbar rotation. Pelvic tilt seated. So whilst in a seated position, gently arch your back and flatten it repeatedly. So you're going into a concave position and a convex position. You're arching your back and then elongating your back, and as you elongate, you sit on your tailbone. Move through a comfortable range of motion in a rhythmical manner without holding your breath. Repeat 10 times. You're controlling this with tummy muscles and you're moving stiff areas of your back. A lumbar roll. Now, using a lumbar roll when sitting over a period of time can take stress off your back. Sitting is challenging for non-specific back pain. The stress of sitting builds up cumulatively on structures such as lumbar discs, and you can reduce pressure through those structures by introducing a lumbar roll in there. Walking. It's important to keep mobile, and it's important to do as much normal exercise as your body's allowing you to do, and walking's perfect. So start a walking program and use walking as one of your tailored exercises. So start perhaps 5 minutes, increasing that to 7.5, and then maybe 10 minutes. So incrementally increasing walking. You can add a variation to the pace of walking. You can even do intervals. Try to walk on a flat surface and use cushioned shoes. Here is the worksheet to accompany the exercise video. If you would like an electronic copy, please send us an email and just ask for the correct worksheet. Thank you.